I'm the Green Smoothie Girl, and I'm here at the Oasis of Healing, and I've met Christine Healy here. She's from San Francisco, and she's here with her friend, and they are, you're her caretaker, and it's a really great idea if you come here to have someone to help you with everything. Christine is a recent breast cancer diagnosis, yes?
Yeah.
And she decided she didn't want to have high-dose chemotherapy, so she came here for IPT, which is what?
It's called insulin potentiation therapy. So it's a low-dose chemo, so you get less than 10%, but it's the way they administer it so that most of it is targeted towards the tumor with minimal damage to your healthy cells.
Okay, so you're getting about 10% of the actual chemotherapy drug that you get in traditional oncology.
Right.
And what do you have all these ice packs on you for?
Well, even when you get less than 10%, there are still some effects, and so we do this as a preventative measure. So some of the chemos that we receive can cause hair loss that we've seen with full-dose chemos. They cause peripheral neuropathy, which, you know, numbness in the fingers and toes, and so we put ice to constrict the blood vessels in our hair. I'm going to be soon wearing my ice cap, and we constrict the blood vessels that are on the surface so that the chemo does not penetrate those blood vessels to prevent the hair loss or any neuropathies.
Interesting thing about Christine is not only is she a mom of 4 and just a few years younger than me, but she has been dealing with nutrition and fitness your whole life, right?
Yeah, well, for many years, and I've been in the health industry for over 20 years. So
you're totally shocked to get this diagnosis.
All my friends are shocked that it was me.
So, but what were you teaching nutritionally that has changed now that you've learned what foods cause and prevent cancer? What are you going to go back and do differently? What have you learned that maybe you weren't doing right before?
Much more emphasis on living foods, although I always did that. I think the biggest change is making my diet mostly plant-based. Right now I'm 100% plant-based. I actually plan on being that. No, I've gone vegetarian and vegan. So I miss my cheeses. I really do. I have to be frank.
Is that the hard thing?
That was feta cheese was my hardest thing.
Well, Dr. Lodi said there's no more carcinogenic substance on the planet than casein. And the reason he says that is because, of course, the China study, you know, Dr. Colin Campbell, Oxford and Cornell, the diet that they fed the mice and rats that was 20% protein was casein, and 100% of the mice and rats got cancer. When he fed them only 5% protein, animal protein, 0% of the mice and rats got cancer. So he thinks it's a highly toxic food to eat, casein, and a lot of nutritionists are giving people lots of like whey protein and encouraging them to eat a lot of
casein protein shakes. And I worked with a lot of athletes who their diets mostly consisted of casein protein shakes and whey protein, that's going to really change when I go back home.
Yeah, and you're going to be swimming against the stream. I've been working with some personal trainers who are swimming against that current, and they're teaching people to eat a raw plant-based diet. You're not going to bulk up as fast. There's not that instant gratification, but the proteins that we cobble together from amino acids in plants create really durable proteins.
It does.
Now you can go back and teach people a different way that's still effective, but so much healthier.
Yeah, it's going to completely change, but it's a blessing. This journey is what it is, and I have a bigger ministry and a bigger mission now. So.
Yeah, a lot of times the things that are the super scary diagnosis or wake-up call, or Dr. Lodi calls it the divine tap on the shoulder.
Yes.
The blessing can actually change some things, not only for you, but probably for other people around you. That'll be a blessing that 10 years from now you'll look back and get that.
It is, and we have to look at it because mindset is such a big part of this, and eating, and I'm really feel very empowered now to really listen to my body. That's the biggest thing, because you're going to get a lot of diet plans. You're going to get a lot of different people saying, you'll go from location to location. You'll go to Hippocrates and you'll come here, and then you'll go to Gerson, or you'll go to someplace in Mexico, and they all have a little different version of what's right and wrong. And you gather all the information, and what I've done is I've had to listen to my gut of what's right for my body. It's the biggest thing, is listening to the little voice inside the whole way. So,
what are some of the therapies that you're doing here? Besides insulin potentiation therapy or low-dose chemo, you're doing vitamin C.
Vitamin C, hydrogen peroxide, a selenite, I'm doing
sodium selenite. Dr. Lodi is one of only 2 physicians in the nation using that. So we'll talk more about that.
Yeah. And then I'm doing something called UVBI, which oxygenates my blood. So they put ozone in, they take out 150 milliliters in my blood in a glass jar. I have to mix it for 8 minutes and combine ozone with it. It turns a bright red.
Yeah, we saw you doing that with your blood.
Yeah.
Like, look what's happening to the color. It gets more red as it oxygenates.
Yeah,
yes.
that's oxygenate, and cancer hates oxygen. I've limited my sugar to less than 24 grams a day, and that 24 grams usually comes from a fruit source. You know, the average American should have less than, 50. The average American has more than 200 grams.
Right. We're getting more than 400% the sugar that we should be, and we're getting almost all of it in the form of refined sugars.
I've got to put my ice on my head.
Yes, you do. Here she goes.
But anyway, sugar feeds cancer. It's the only way. That's the difference between healthy cells and cancer cells, is that that cancer only lives on sugar. And so it's like I almost feel it whenever I have sugar above what I should have, that it goes directly towards feeding the cancer, because it has the most insulin receptor sites. That any sugar we intake goes to feed the cancer and cancer growth. So I know that all the therapies I'm doing has halted it, and now my goal is to reverse it, and our bodies can heal.
And you haven't done any chemotherapy and radiation. You came here first, which is pretty exciting. You don't have to undo the damage of chemo.
Yeah.
I'm really excited to be here learning from Christine and Dr. Lodi at an oasis of healing. Thanks so much for telling us your story.
Thank you. Thank you for
really excited
bringing
to
this out to the world.
Yes, more people need to see that you can interrupt when you get that diagnosis and learn some other things that you might try, and maybe some things are less toxic first. So
Yeah.
see you next time.
All right.